we've been doing a variety of events up here since June and July. We started a live music program again on Friday nights with a music person who was booking the music. And we've returned to having a once a month Witches Night Out. And we've had some drum circles. We've had the Death Cafe has begun again under the direction of Marilyn Rush. She'd been doing it for 7 or 8 or 9 years. Here on one Saturday a month, a place for people to discuss illness, chronic illness, death, family issues related to dying and hospice and people's feelings about death. And we've also been using this space for other kinds of talks and classes and our meeting room, and we also have a gallery exhibit in the middle space. So thank you for coming. This program tonight, this series called Sages of Ann Arbor, the thinking behind it was that I'm 70, Dennis is about my age, and I know a whole world of people in Ann Arbor who are in their 60s and 70s and 80s. And I think that this generation of Ann Arborites and of people around the world who are baby boomers, who are reaching these ages, are reaching them and have evolved and are evolving in ways that no one on the planet has really done in previous generations. People were not living this healthy and this active and this motivated and this curious about what this stage can be now that one can be in one's 60s, 70s, 80s, and even 90s in reasonably good health. And many of these people that we've been writing about and interviewing and featuring in the Crazy Wisdom Journal over the decades are individuals who have evolved in interesting ways, either in terms of their own spiritual development, their psychological growth, their understanding and depth of knowledge in integrative, complementary, and holistic medicine, and in terms of their ideas about sustainability and green living. So I thought it would be interesting to begin to bring together people of that age group, or anyone else who wants to come, to create conversation around on a local level. We can all read these things in articles and in newspapers and magazines, but to bring people together in the Ann Arbor area and in this region to talk about aging and saging, to use the phrase that Lucinda and Oren used at their salon 2 weeks ago. So we have some very interesting guests for the first fall. In addition to Dennis, who's here tonight, who I will introduce in a minute, we have Dr. Jay Sandweiss coming in November, and he's seated right here. And he's also a very well-known force in integrative medicine in the region for decades, and in acupuncture and Chinese medicine and osteopathy, and in healing. And we have in 2 weeks Lisa Gottlieb, who is a strong and interesting woman who has been in town for many decades, as the other speakers have. And she started the Selma Cafe. She's been deeply involved in the organic food and farm-to-table movement. And in recent years, she's been involved in teaching and leading workshops in nonviolent communication. In later October, we have Barbara Brodsky, who founded and is the director of the Deep Springs Center for Meditation and Inquiry. And she's also an author of books about meditation and consciousness, and she's coming with her son, Davy Rothbard, who is an author in his own right, and was the editor of Found magazine. So thank you for coming, Dennis. I've known Dennis for a number of decades and followed his work to some degree. And I assume most of you who've come tonight kind of have a sense of who he is and his accomplishments. He's illustrious figure in the Ann Arbor and regional community as a physician, as a homeopath, as a leader of kirtan chants, as a meditation instructor, as a Tai Chi practitioner and teacher, as a breathing teacher and leader, as a healer, and also doing psychological growth work over the decades with his medical client base. He's also the author of 3 books, as Susan said. We have 2 of them here for sale tonight, and as well as one of his CDs. He's deeply involved in music too, and in chanting and in kirtan. And we're going to try to do an interview, that is going to begin with me asking some questions, and I'll have some other questions, but I also want to really engage this group of people to also engage in the conversation with questions for Dennis or comments. So we'll start there. Okay. So, Dennis, you're a grandfather. How many grandchildren do you have?
9.
9 grandchildren.
Yeah.
Will you tell us a little bit about your grandparenting and what it consists of and what it means to you?
Oh, that's a great question. Probably the one question I like to talk about the most. It's been great. I mean, I would say that parenthood was wonderful, and having raised my kids here in Ann Arbor was a blessing. I'm so grateful to have done that. And then my 9 grandkids, unfortunately, don't live in Ann Arbor, but I get to see them a lot because as we'll find out about me as we go along, my practice is less intense than it used to be, so I have more time to travel. Grandparenthood is very spiritual. I think that's the thing that I think most grandparents would probably say. Unless you're in a situation where you have to take care of your grandkids a lot, let's say an absent parent or something, or some tragedy. But generally, grandparenthood is just supportive and loving. I don't criticize my kids for what they do. I don't have to watch them and say, you need to do this, and your grades better be this, and just kind of what you do as a parent. Although it's pretty easy going as a parent. And grandkids, it's just like you just watch and love them. I just got back from Spain, where my daughter has moved with her 2 little kids, and all we did was hug the whole time. We just walked around, hugged each other more, and ate some food, and had some ice cream, and it was just a great experience. So I would say it's a spiritual experience. It's a wonderful experience. I recommend it for everybody.
Perfect chance to engage a little bit. Anyone have a comment about grandparenting?
Yeah.
I agree with everything you said.
Yeah. Not much to disagree with.
Where are I know you just moved from Florida. You just introduced yourself. So where are your grandkids?
They're here.
Oh,
so
wow.
People say, why did you move to Ann Arbor? Grandkids.
Oh.
And hurricanes, Yeah, they're 2.
I got a son in Tampa right now, and I just texted him and I said, "Are you okay?"
I know all my friends are down.
Yeah.
Anyway, my grandkids are, Penelope is, I can't remember numbers, 7?
Nice.
8,
Nice.
And,
Great. Good for
and
you.
Asher, and he's not Jewish, but they named him Asher, is 4.
Nice.
Very
Congratulations. I have a Penelope too.
You have a Penelope grandchild?
I do.
And where do your 2 of your grandchildren are in Spain? Or 3?
Yeah.
2?
Two.
And where do your other grandchildren live?
I have 4 down in Tampa, and although he's commuting between Nashville because he got a really good job, they're trying to figure out what they want to do. Whether his wife wants, she's a doctor, so they're trying to figure out what to do. But he could not take this job. And then I have a son in the Chicago area, in Oak Park, Illinois, and he has 3 kids. My Penelope is in Chicago.
How old is your Penelope?
14.
Oh, boy.
Great, and we're going to skip around because I'm going to try to, I don't have a lot of experience doing this, but I want to keep people's interest. So we're going to move from personal to professional to bigger picture and then back again and in and out. So I have some questions about your kids, but my next question for now is, will you tell us a little bit about your work with breathing and with, kind of talk about that a bit?
Sure. So my breathing journey started when I was a little kid, and my parents were divorcing, and it was a really stressful time. They were arguing and fighting in all sorts of ways, and I would get dizzy spells. I think it probably had to do with just being stressed. And so I found that I had to call my mother, and she picked me up, and it would be a drag. But I found that when I go home and I start just relaxed and started watching my breathing, the dizzy stuff would get better. So probably it was stress, holding my breath, and all sorts of stuff. Anyway, fast forward into my mid-20s, I was exploring Eastern thought, mysticism, and I found a teacher who I gravitated to. We'll probably talk more about him as we go along. And he taught meditation, homeopathy, breathing. A lot of the things I learned were from what's called the Himalayan Institute. Swami Rama and Rudy Valentine were my mentors, and Swami Ajay. Anyway, part of when I met Swami Rama, he said, I want you to come study with me because I wanted to learn meditation. And he said, but you have to learn homeopathy too. I said, what's homeopathy? Well, I eventually learned a lot about it. But part of the journey in meditation is the breathing. The breath is the link between the body and the mind in the yogic perspective. And when you have anxiety, you tend to either hold your breath, or you breathe too quickly, or your breathing is irregular, and that affects both your body and your mind. So we did a lot of work on breathing, and I learned how to do maybe about 8 different breathing exercises, and I found that they have different health benefits. So not only were they important for relaxation and stress management, but also there are certain physiological and psychological and even spiritual benefits to the various breathing exercises that I practice. And so I learned them, and now I teach them. So if a person has, for instance, thyroid problems, I teach what's called Brahmari, which is the sound of the bee, which really relaxes the thyroid area and the throat area. If people have problems with ulcerative disease or reflux disease disorder, I teach them exercises that will stimulate the stomach area, and they're also part of the breathing exercises. So that's how I got into it. I do it pretty regularly. I try to meditate every day. I don't get down on myself if I don't. And part of the meditation practice I do is breathing exercises. One great breathing exercise is alternate nostril breathing, where you breathe alternately in one nostril and then the other nostril. And that helps to regulate the bilaterality of the brain, because there's a left brain and a right brain. So when you breathe through your left side, it affects the right side of the brain, and vice versa. So it's a way of really integrating the two.
Has it been a part of your medical practice all the way through these last 45 years?
Yes, absolutely, yeah. So sometimes people come in, sometimes they have sore throats, sometimes they have colitis, sometimes they have pneumonia or COVID or whatever it is. And some people come in just to do some breathing with me, because it's just very therapeutic. And being a physician, if someone comes in with anxiety, for instance, and I teach them alternate nostril breathing or diaphragmatic breathing, I can code it as a medical visit, so they don't have to pay, because it goes to their insurance, and it's a good opportunity for me to, as a physician, to interface on a psychological, spiritual level with my patients, and breathing is part of that tradition.
Over the years, did most of your patients who came to you know that you were and are a holistically oriented physician, or did some just kind of come in just kind of come in without really realizing that?
Well, it's a really good question, Bill. You ask great questions, by the way. We met the other day, and he just so many great questions and really opened me up. So I like this guy. He's good at great service. And thanks to everybody for coming. I mean, I know some of you very well. This is my art teacher over here, Tom, and Laura.
You forgot to mention he's a budding visual artist too. You didn't mention that.
We're going to get to that.
And Jay and Ken and just all these, and Hassan, who now owns my building. Not my building, it's his building. But so thanks for coming, everybody. And I teach a course with Laura. She's a yoga teacher, so and so I have old friends here and some new friends, which is great. How do people find me? Well, if you go back to the mid to late 70s, people found me because I lived in a yoga ashram. I lived in a yoga ashram for 5 years. And at first I was learning, and then eventually the whole organization moved out. Most of the organization moved out to Pennsylvania. They bought a big old monastery, and it was a big holistic center and meditation center called the Himalayan Institute. And my teacher said to me, "You can't go." I was crushed. He said, "You can't come. I want you to stay here." And I said, "Well, why? Everybody's going out there." He said, "Because if you go out there, everybody's going to want to be around me, and you're never going to be able to talk to me in the way you want to talk to me and learn from me, because everybody's going to be clamoring over me." He said, "Stay here. I'll come back and I'll teach you," which is what happened. So I had the opportunity to have, to work with him, and he taught me a lot of things. And people would come to answer the question more specifically. People came to the Himalayan Institute because we were a yoga organization that was doing homeopathy and holistic stuff. So people came to me for that reason. We had a 3-year waiting list. It was amazing back in there. It was like we had 4 doctors. It was so hot at the time, holistic medicine. And we were some of the originators. Here is a little different. I think in the beginning, it was mostly holistically, or there's a new guy in town, he's holistically oriented, he does homeopathy. I was the only homeopath in town. And so people came in the beginning. I had a lot of kids. As time has gone on, though, I would say, because Ann Arbor is not a huge community, not like Chicago, which is 7 million people. We have a smallish community. We have Detroit, but it's still sort of a different world in some ways. Over time, because of insurance, I think people get assigned to me through Blue Care Network, for instance. They get assigned to me through Priority Health. So I have to say about half of my patients just either were assigned to me, or they needed a family doctor, and they heard that I was a good doctor or whatever, and so people come to me and they aren't necessarily as interested in the holistic approach to medicine, although once they see me and meet me, then I sort of gently get their diet changed. Hey, you're under a lot of stress, let's do some breathing together. So it changes them, but it is different. It's a good question.
So many threads there. There are 4 or 5 threads there, but let's take from what you just said. Can you tell us a story about someone who came to you not knowing, one of the 50% who came to you not having any idea what you did, who was kind of revelatory for that person, and then a story about somebody who came and also didn't know anything about your kind of holistic orientation, and where it was sort of shock and awe in a kind of like, oh, I don't want this.
That's a really good question. One person came to mind, and he was a very nice man. I think I've been my patient for 35 or more years, and he came from a very Catholic background. In fact, he was going to be a priest. He was in the seminary, and then eventually decided he wasn't going to do it anymore. So he came to me just, he heard I do some alternative stuff, but wasn't particularly interested. And over time, because of his health concerns, I started introducing homeopathy, meditation, exercise, nutrition, good nutrition, to do a lot of work with nutrition as well. And he became probably my most committed meditation student over time. And
Kind of a slow.
Yeah. So it was just quite interesting. And he took courses with me and would meditate. We'd meditate together sometimes in my office, and it was quite a journey. And he's pretty sad because I'm changing my practice right now, but he'll still keep coming. So that was one person that came from a very Catholic background to be more holistic. He's still Catholic, but he's interested in all sorts of different stuff. Yeah.
And when you first came here in 1971, I think you said, you came here to go to medical school. And can you give us a sense of, I think that's the same year that I came here as an undergraduate. I believe Dr. Sandweiss came here that year too.
We lived in the dorm together.
Right?
You and I lived in Aliceville.
That's right. Exactly. And Dr. Chernin was coming here as a medical student. Dr. Sandweiss and I were exposed right away to sort of culture as formative students, young students. You were entering a very ironclad medical establishment, the allopathic establishment. Can you describe for people at all about sort of what Ann Arbor meant to you and how it began to influence you?
Came here, I got into a bunch of medical schools, and I came here because my sister had been here. My sister and I were very close. And so she liked it. I was at Northwestern undergraduate in Chicago, and I got into medical school there, and I was trying to think of where I wanted to go and a couple other places. And because Michigan was more rural, it was beautiful. I kind of want to get out of Chicago. It was a little bit too hectic. So I came here, and the first thing I did is I met a guy who was still one of my best friends. He was my roommate. He actually sought me out because I knew his cousin in Northwestern. Anyway, first thing I did, met him. He worked for the CDC. He was one of the big shots at CDC. I hoped he had been head of the CDC, but he was too political. He didn't want to do it. Anyway, he's moving back to Ann Arbor. His name is Rick Goodman. But anyway, so the first thing we did, met a bunch of guys and went to the Blues and Jazz Festival. And that was my introduction to Ann Arbor. One of the original ones. I think may have been the first or second.
It was probably taking place a few weeks after you got here.
Yeah, it was so much fun. I was like, when I came here, as an undergraduate, I was pretty studious. I didn't do drugs, I didn't do alcohol. It was just, I wanted to go to med school, I knew that. I also wanted to stay out of the Vietnam War because my draft number was 25. So I said, I'm not going to Vietnam. So I knew that I had to get into med school because they were deferring positions of medical students at the time, thankfully. And so I went to med school, and it was a relief because when you're an undergraduate, you're trying to get into med school. I think, Hassan, your son is trying to go to dental school. What it's like to be scared about not getting in, not only because that's my life. It was my life passion to be a doctor, but also because the war is raging and I didn't want to kill anybody or get killed. And so, that's the honest truth about it. So, I came here and took a big breath. They weren't going to fail you out. It's almost impossible to fail in med school. They're investing hundreds of thousands of dollars in you back in '71. And so I was relieved, and I knew I would be okay. So I relaxed. And I had so much fun in medical school. It was like the best time. I've had other great times in my life, but it was a great time in my life. And it was just carefree, studied hard, worked many, many hours, but I had a lot of free time between exams, and did some traveling in the summers, and didn't worry so much anymore. I knew I was going to be a doctor, and just got to figure out what kind of doctor I was going to be. But that's my introduction. And Ann Arbor was a pretty hip place. There's a lot of hippies here. And I was kind of a non-drug taking hippie. I showed Bill my picture of me when I was, but when I got married and when I got here, my beard was down to here, and my hair was down the middle of my back. So if anybody wants to see some crazy pictures of Dennis Chernin, it's kind of funny.
This would be a good point. Anyone have a question right now or a comment? If not, we'll keep going on. I have a question for you. Is it Han?
Hassan.
Hassan. Did you know before buying the building how sort of special of a medical clinic it has been over the decades?
I did not know that.
I see. You were looking at it.
I won't buy it. Of course, as a dentist, I heard about medicine, approach.
Yeah, my sense of the Parkway Center was that it has been both the most renowned, but also that it was really the first clinic where not just Dr. Chernin and Dr. Linkner, but all the other practitioners were in one way or another taking a holistic and integrative approach to whatever they were doing, whether they were doing, chiropractic or dentistry or aromatherapy or other homeopathic practitioners. And you've had quite a array of alternative practitioners in there over the decades.
It's been a great run. I mean, and I'm still there, by the way. I'm still working there, and I gave up my lease to a wonderful holistic gynecologist, Suman Tavari. So if anybody here needs gynecological care and wants to do it from a holistic perspective, she's great, and she's taken over my lease. So I've gone from owning a building to being a subletter. So it's been really freeing. It's really nice for me. It's really nice.
That's a good feeling.
It's a great feeling, yeah. It was time, I can talk a little bit more about what I'm doing in the future, what I plan to do in the future. Yeah, it's been the Parkway Center has been an amazing place. We've had so many interesting people come and go. We've had some people who've been there from the beginning. Castle Remedy is there, which is a great, little store. And we've had holistic dentists and psychotherapists and nutritionists and body workers, DOs, MDs. It's just been great. Naturopath, yes.
Herbalists.
Herbalists, yeah, that's right. Yeah, so Ken's wife is in the building. Gary.
12, 15, I don't know how many years.
Lots of
15
years. Yeah. Ken and I play music together too, so another good buddy.
And over the years, you mentioned that you're feeling some sense of pleasure and relief. Will you talk about that at this stage of life, the process of taking some steps to let go or to do less or to change your practice? I mean, we'll come back to it in other ways, but talk about that a little bit.
It's been a process for me. I would say the last 5 to 7 years I've been thinking about it, stepping back a little bit because I had a busy family practice. I think I counted the number of patients that I think I've seen. It's at least 100,000 people I've seen over the years. Yeah. Now some of those are the same people, right? I mean, because people come back. But in terms of the numbers of patients I have seen, it's about 100,000.
Meaning 100,000 visits.
Visits, right?
Yes.
I don't know, 30,000 people I've seen. I don't know. I'm not sure, 40. I don't know. And that doesn't include Chicago. That's just Ann Arbor. And so, because I was in Chicago for 5 years.
Well, I'm going to be a bit statistical for a second.
All right.
So, a lot of these people you see for many years.
Yeah.
And so, if it's 100,000 visits, then it may be more like 8,000 or 10,000 individual patients. What makes you think it's 30,000 to 40,000?
I've seen so many people for one time
Yes.
as a consult.
Yes.
So yes, I had patients for many, many years, for 43 years, because I've been in Ann Arbor for 43 years. I have some patients. I have one family I see 4 generations. And I have a lot of people who want to say, well, I want to try homeopathy, or I want to try meditation. I want to check out Chernin and see what can you offer me. I would say it's at least 30,000 is my guess.
Have you found it's, will you talk a bit about homeopathy? You've written a book about homeopathy. I think we should spend some time on homeopathy and on not only homeopathy and its applications, and then a little bit about the bigger picture about how it's evolved in the culture and in Ann Arbor. So start wherever you want, but we'll take a little time to talk about homeopathy.
Okay. Who here has taken a homeopathic remedy? Oh wow, speaking to the choir. Tom, you better raise your hand.
I did.
Oh, okay.
That's as much as high as I can read.
There's a remedy for that.
Yeah.
Arnica. The first time I ever heard the word homeopathic was in medical school when they were talking about thyroid medications. That the guy that was an endocrinologist, actually a really interesting fellow, really cool guy. Dr. Matavidic, he was from Yugoslavia at the time, and he was just interesting. He's so loving. I mean, I learned how to be compassionate as a physician. He taught me how to do that, I think. Anyways, he was talking about very, very small doses of thyroid medication to treat the thyroid. He said, they're homeopathic doses. And it registered, but I said, I have never heard that term before. That was in med school. So then, as I mentioned before, when I met Swami Rama, he said, I'll teach you meditation, but I want you to learn homeopathy too. And I was an allopath. I have an MD from the University of Michigan, which incidentally was a homeopathic medical school until 1920. Yeah, it was a great homeopathic medical school. Homeopathy goes way back. Anyway, so then I started learning homeopathy, and one of the ways to learn homeopathy back then was to take remedies yourself. So he and my mentor, Rudolph Ballantyne, who was a psychiatrist, homeopath, he was about 10 years older than I am, 9 years older than I am. They gave me a remedy based upon the symptoms. You have to take a very careful symptom picture, and then you prescribe remedies based upon the symptoms. I'd have to sort of tell you what the laws of homeopathy are to understand that. But I remember he gave me a remedy called sulfur in a 1M potency, a 1,000 potency. And I was sitting there talking to patients, and all of a sudden, in the middle of the day, because I took it in the morning to take home, to take sulfur in the morning, I actually felt like I was being pushed back in my chair. And all of a sudden, I started getting very happy. I said, am I taking a drug? No, it's not a drug, because homeopathy is beyond Avogadro's number, meaning there's nothing left in the remedy other than energy. But I felt an energy rush that was really fun. And it came and went, and I felt better. Some of the problems I had, like some problem with my leg, and I was having some problem with my eyes. And I started going through a healing process. The remedies really catalyzed that. Started working with patients, and I found that people would change, they'd get better, especially chronic diseases, but also acute diseases, sore throats, ear infections. Little kids would come in. One of my colleagues, you mentioned Dr. Linkner, came. I met him at a conference, and his son had an eye infection, and he couldn't. No one could treat it. Antibiotics, nothing was working. It was like months and months. He came to see me in Chicago and wanted to learn a bit more about homeopathy and treat his son, and I gave him one remedy, and the symptoms were gone. It's a remedy called calibichrome, because the mucus was thick and sticky in the eye. It wasn't thin and watery, and his eye wasn't red. It was thick and sticky. And that is the classic symptom for calibichrome. Cured it. So I'm learning too as I go along. And then I taught about 10 doctors in Chicago at the time. And then I moved to Ann Arbor, and then I started teaching here. I was really interested in homeopathy. It's changed over time, though. The interest in homeopathy has waned. It's interesting. It was extremely popular back in the 70s, 80s, and 90s. And I had lots of kids that took homeopathic remedies. And I'm not sure. I think it has something to do with evidence-based medicine that people get, jammed down their throat when they're in medical school. I think it has something to do with the economy. I think it has something to do with doctors coming out with $300,000 of debt after medical school, after college and medical school, and they don't have time to learn homeopathy. They're really intent on getting a practice going and paying their loans back. I think the culture has changed a little bit. I think there was a sense of freedom, when we were back in the 70s and 80s. It was a lot of freedom of thinking and new ideas, and homeopathy, even though it went back to the 1700s, was again new. Homeopathy has waxed and waned over the centuries, actually.
Has it waned significantly in the last 15, 18, 20 years?
I think so. I would say that I haven't had a doctor come to me in probably 5 years saying I want to learn homeopathy. Where I was getting doctors 3, 4 a year saying I want to learn, and I was teaching people. So I think it has changed. Yeah.
I'll just observe that Whole Foods has withdrawn their homeopathy. You can't get it anywhere at Whole Foods.
Is it right?
I know. I wrote letters, I called, yeah.
Interesting.
Gone, yeah.
Wow.
They should change the name to Amazon.
That's
Yeah,
right.
And
exactly.
the FDA's been correct, like,
Yeah,
No, the FDA monitors homeopathic remedies. There's a homeopathic pharmacopoeia, and it's been around since the 1700s when homeopathy first started. 1700s in Europe. It's 1825 in the United States. The first medical society wasn't the AMA, American Medical Association. It was the American Homeopathic Association, the AHA, back in 1847. Yes.
What about health conditions like ADHD and, let's say, autism, things like that?
I mean, that's a great question. Yeah. I have treated autism, and I have treated ADHD with homeopathy. It depends on the severity. If you have a kid that has autism this is all he does or she does, and they just touch things, and there's no comprehension, and they're volatile. you can use remedies, but really they need something like an antipsychotic, like risperidone or something like that. It really depends on the situation, how bad it is, what the condition is, what the parents want. But there's not a condition that I don't feel comfortable treating. I'm very careful about treating cancer. I don't treat primary cancer. There have been homeopaths. There's a man in India that treats primary cancer. There was a guy that lived in the area that I lived in Glenview, Illinois, that treated cancer before the chemotherapy drugs and radiation therapies and all the other things that we use now, surgical techniques, immunosuppressants, all sorts of things that we use now, immune modulators. So I would say that the answer is yes. Now, if I have a cancer patient, I say you need to go through regular cancer chemotherapy or whatever technique the oncologist wants them to go to, or the radiation oncologist. But I will treat their side effects. And I've treated people who gave up on chemotherapy, who maybe were in the process of dying or very sick, and they'd say, I'm done with the chemo. And, I'm careful medically, legally, because I don't want to lose my license, because that's a pretty, very deep, awful disease in some cases not. So I'm careful, but I have used homeopathy, for primary cancer, but it's usually after they've withdrawn their treatment, and we're very clear this is what I'm going to be doing. So, but in the old days, there's some really interesting cases of cancer that have been helped with homeopathy.
You're the director of two county health departments over the years. Which two counties?
It's actually three.
Three. I'm sorry.
So it's Jackson County, Lenawee County, and Shiawassee County. I got a master's in public health. What happened with me is that I did my first residency was psychiatry. I was at University of Wisconsin. And I met my teacher, my meditation teacher, spiritual teacher, I guess you'd say. And when I met him, I realized it was an opportunity that was more unique than the psychiatry residency. So I left my program. So I did a year of psychiatry. And I studied with a Jungian analyst and a Freudian analyst and some family therapists. Carl Whitaker, do you know who he was? Carl Rogers was at Wisconsin, so he had a big thing there.
You had to learn how to nod.
Yeah. So I studied, so I left my program. I spent 4.5 years learning meditation and all the things we just talked about. And then when I came back to Ann Arbor, one of the reasons I came back to Ann Arbor was because I wanted to complete a psychiatry program. But what happened was the chief resident and the head of the department were fired because they were transforming from a psychotherapy model to a biochemical model using drugs for psychotherapy. Psychotherapy became secondary, but the drug therapy became primary. I didn't want to do that. I had been studying Jungian therapy in Chicago. There's another little story there. But I started my practice, and then I had a feeling I needed to finish a residency. So I went back and I got a master's in public health, and part of that is doing a residency. There's clinical parts, and so I did that. And so it took me 3 years. I had 3 kids, and I was working almost 4 days a week and going to school during the day and during the night. It was a busy time, let me tell you. And so I got my master's in public health, and then I got a job with Shiawassee and Livingston County at the time. And,
did you, over the years, as a director of kind of these county health departments, incur resistance at times to your integrative worldview or point of view, or they were sort of on two different tracks, your work?
They were on 2 different tracks, really. I think they all knew that I was kind of out there, but they liked the fact that I was doing a good job and I was easy to get along with. I'm the medical director.
Yes.
The medical director is more of a consultant. I actually get paid as a consultant rather than I'm not on, I don't have a salary. So I'm a little different. And so I keep a little distance. I'm more of a consultant for communicable disease. I'm the chief epidemiologist of the county. So any communicable disease, whether it's HIV or hepatitis or COVID. There's a lot of stories around COVID. So I feel that I kept them separate. They kind of knew that I was this sort of doctor who was doing alternative stuff, but it seemed okay. Everybody seemed they were sort of interested. I mean, these are rural counties. We're talking about Shiawassee County, which is really rural. I mean, the biggest town is 10,000 people.
We have a question then. I also want to say it had to, before the question, which is, had to take skill to navigate these traditional health departments as an Ann Arbor doctor who kind of had a worldview that was somewhat different.
Yeah.
But unless you'll answer differently, and I'll ask the question, did you at times ever encounter problems or political problems because of it, or not too much? You just kind of navigated it sort of skillfully. I mean, I'm not asking you to praise yourself, but it sounds like it would have required a lot of political skill, considering your worldview to some degree.
Yes, that's a very good question, and one that I basically have navigated well. And I know that I'm not the boss. I know I'm a consultant. I know the health officer is the one that's responsible for talking to the county commissioners and talking to the health boards and talking to the media and talking to the hospitals, and I'm there as a consultant. So I have been very respectful but strong. All my health officers, except for one, have looked at me as a necessary person who they relied on because they don't have the medical knowledge. These aren't doctors. These are like health. There's a lawyer I worked with that was a health officer. There's some nurses. There's some business people. There's a lot of sanitarians that move up in the world of public health. So I have expertise that they needed, and because of my personality, I'm not trying to take their jobs, because there has been some doctors who actually have become both a health officer and medical director and have taken the jobs of the health officers, and they never felt threatened by me. In fact, once they asked me when one of the health officers retired if I wanted to take that position. I said, no thanks, I practice, I want to be a consultant. So I have that reputation of not challenging, but I'm also strong, where if I don't agree with the health officer, I say, look, let's think about this differently. It came up with COVID over and over and over again. Because there was so much panic and we had to do so many draconian kind of things with the communities. It was a very interesting time, but yeah, so it's a good question, Bill.
And I think the same question will come up in some similar ways when we talk with Dr. Sandweiss in 7 weeks, because he's also achieved a kind of sort of national reputation in what he does, but he's also an Ann Arbor-based kind of physician, and I think that when you take a picture of the Ann Arbor integrative doctors, they've established a lot of credibility around what they're doing, even though your worldviews were quite apart from traditional models. So I think that's to the credit of our Ann Arbor integrative physicians. Yeah.
I won't speak for you, Jay, but I have a feeling you will agree with me, or if you don't, let me know, either today or next time when you do your thing. I think it's really important to navigate the community well. I'm a physician. I'm a doctor. I'm a physician. I'm a healer, right? It's very important for the physicians in Ann Arbor to respect me, and even though, because I do homeopathy, and most of them go, "What the heck is that?" And but at the same time, so I have to send people to ER all the time. I send people to GI people. I send people to GU people. I send people to orthopedic surgeons and maybe give them homeopathic remedy like arnica or something if they broke their leg. And in the beginning, it was a little rough, but over time, I believe I've earned the respect of the medical community, and it's been very, very important for me because I need those people to do the work. If I have someone with cancer, I'm not going to take care of those people. If I have a broken leg, if the patient broken leg, I'm not going to do that. If I have somebody who has problems with their teeth, I have to send them to the dentist. I need people to look at me and say, Chernin, send these people to me, that's good. He's a good doc. He may do some things that I don't understand, but he's reasonable. He's not trying to treat cancer. He's not trying to treat someone with congestive heart failure. He's not trying to treat with malignant hypertension with remedies or herbs. He's using drugs and medication. Because I'm an allopath too. One of the reasons I started to shift my thinking about my medicines, I had one guy who was taking 13 different drugs. I said, what am I doing? I like using homeopathy. He likes using drugs. I don't mean like drugs like cocaine or anything like that. He's just like medications. He loves medications. He's always asking me for more. And then I thought he was only on 8, and then he tells me that he's taking 12 because he didn't tell me he was taking 4 from specialists that he never told me about. I said, oh, wait a minute. Anyway, so the question is a good one. How do you navigate? I think, Jay, you would probably say you read a lot. You're very well respected. Everybody knows you and refers to you, and physicians come to you. I have a lot of physicians that come see me as well. And a lot of Indian physicians actually. It's been very interesting because homeopathy is really big in India. It's the center of homeopathy now. And so I have neurosurgeons and cardiovascular surgeons and cardiologists, and they bring their family. They said, don't tell anybody, don't tell my colleagues, but I want to try some remedies here. and so it's been interesting. So I have a large Indian population.
Did you have a question?
A lot of Germans too, actually, because they're really interesting. Yeah.
Hi, I work with individuals with hypermobility disorders, and I was curious, when you're treating inflammation, do you treat based on the condition they have, such as mast cell activation syndrome or long COVID, or the condition, or based on the body part that's affected, or how do you approach treating inflammation?
The first thing you said was, did you say hypermobility?
Yes.
Okay, so I don't teach yoga for people with hyper. I'm a yoga teacher, I'm a certified yoga teacher. I don't teach homeopathy. I don't do that.
It would be a different.
It's a whole different world, right?
Yeah.
Because they're already too loose.
Right.
Right.
Exactly.
So yoga's not for everybody.
Yeah.
I tend to be pretty taut, so yoga is good for me, but sometimes it's hard because it's like I'm pretty, my muscles, pretty, I guess strong, but also not flexible as I would like to be in some ways. But the idea of inflammation. There's many approaches to inflammation. There's diet. There's anti-inflammatory diets. There's anti-inflammatory medications. There's homeopathic remedies that are useful for inflammation. But in homeopathy, we don't call them anti-inflammatory because we treat the whole person. We treat the disorder. So let's take rheumatoid arthritis, an inflammatory disease. It's a disease where the body attacks itself, right? And it causes restriction and swelling and awful things with the joints. An anti-inflammatory would be, okay, well, we can use chondroitin, we can use various other homeopathically oriented substances that have anti-inflammatory effects, or you have people take a diet with blueberries and broccoli and things that are sort of anti-inflammatory. So that's one way to do it, but in homeopathy, we don't treat inflammation, we treat the problem. So let's take rheumatoid arthritis, or arthritis in general. This is a good example. Some people's arthritis are better when they move, the joint gets more loose. Some people are better when they're still, when they don't move. Some people are better when they use cold applications. Some people are better when they use warm application. Some people are restless with their arthritis. Some people are depressed with their arthritis. Sometimes the joints are red. Sometimes the joints are pale and white. Those are two very different remedies. Okay? So yes, you're treating inflammation, but you're treating inflammation by treating the whole person. So the first remedy that I was talking about was Rus Tox, which is Rus Toxidendron, which is made from poison ivy, actually. Hot, red, really hard to get going. It's painful to move it, but once you get moving, it's better. Warm applications are really good for them. So you're treating inflammation, but you're using a remedy. poison ivy actually, in potentized form. The other case I was talking about is a remedy called bryonia. Worse, they're better when they're just still. They don't like to move around. As long as they're still, the joint doesn't hurt so much. Better with cold applications. Where the Russ Tox version is restless, the bryonia patient, which is made, it's cut from white hops actually, it's in the plant, is really irritable. And as long as you don't bother them, they're okay. But as you start talking to them, they get really irritable. That's bryonia. It's a really different case of anti-inflammatory because you're treating the whole person, but you're also looking at the mind and the body in terms of the picture. So homeopathy does things differently. I do things, you know, it depends on the person, you know. I have certainly suggested Humira or Enbrel, you know, for really bad rheumatoid arthritis. Very strong drugs, immune modulator kind of drugs, because they work really well. I mean, psoriatic arthritis is a good example of a drugs that really work well. And so I'm okay with using drugs too. Depends on what it is and what the problem is.
Okay, question. That's a very good question. Thank you. I promised we'd move from at times from professional into the personal, the spiritual, the psychological. So, will you talk about your life's journey in terms of has your life, when you think about where you were when you were 20, could you have imagined your life evolving the way it has?
That's a great question, Bill. See, those questions are amazing. When I was 20, I was
23.
23. Because I was 20, I was just worried about getting med school, as I said, not going to Vietnam. That's what I was worried about. And my girlfriend at the time was worried that relationship would work.
In those 3 or 4 years when you in Ann Arbor, or then you got involved with Swami Rama, and in those years,
At 23, I was in med school, and that was a great time. I loved medical school. I loved what I was doing. It was such a fun, cool time. I was just exploring myself and getting into all sorts of Eastern thought and exploring my own faith in a different way. And so that was a good time. But and I didn't know where I was going with it. I had no idea. I was thinking of a psychiatrist, and I sort of liked Jungian kind of work. I knew I didn't want to be a ER doc or a specialist and put tubes in people. I didn't want to do that.
Let me ask it a different way.
Yeah.
Has life, tell us about some ways that life has surprised you.
My mother surprised me.
Oh.
Yeah, she didn't like my first wife, and she stopped talking to me. She was very doting before, and that was a big surprise. She wouldn't talk to me. And my parents were divorced, and I wanted to get to know my dad more, and that's just sharing some personal stuff here. That surprised me, because she was very doting, and I was the apple of her eye, and I think she wanted me to move back to Cleveland and be an internist. And I met this hippie girl, and fell in love, and eventually eloped. And she didn't like the fact that I was getting to know my dad. That really surprised me. My dad was a really nice guy, really sweet guy. Mom showed me a different side that I didn't know. Eventually, we reconciled.
Was it upsetting to her that you were involved in an Eastern spiritual?
Oh yeah, she thought I was abducted by a cult.
Maybe you are.
Well, I mean, there are some aspects of when you have a spiritual teacher who you kind of follow, but I always kept my individuality. If he ever said something that I didn't agree with or I didn't want to do, I wouldn't do it. I didn't care who he was, and that's because I have my own ethics. But he was a really interesting teacher. I had some very interesting experiences. But he wasn't perfect. Like none of us are perfect. And he showed me sides that I didn't like that much, but overall it was an amazing time.
Did you ever try to tell her about him?
I tried, but she wouldn't talk to me. My dad said, "This is kind of interesting." So I said, "Can I come up and meet him?" And I said, "Absolutely." And my sister, they came up, and it was great. I mean, they enjoyed it. They learned some stuff. And my dad had spent the 4 years in the military in India. So he was already exposed to the Indian way of thinking, and so he was.
More open.
Yeah, he was an open guy. I didn't know that about my dad. He found out later on he used to keep a little stone in his pocket. I didn't know anything about this. He told me because he thought it was good luck. You know, so I think he found it in India actually. And so he was in the military. He was in the east part in Calcutta during the famine of Calcutta when 5 million people died. He was there in the military. They were taking care of the British and the Chinese who were flying over from Burma. He was in the medical corps, and he spent time in India. But they segregated the American military from everybody else, sort of, so he didn't get the full experience of India.
Were your parents Reformed Jews or conservative Jews or Orthodox Jews?
My parents were definitely Reformed, and I was raised very Reformed. I got bar mitzvahed, but I was definitely Reformed, and it wasn't till later on when I started seeing that there was a great spiritual path of Judaism as well. And I was talking to you about that the other day, is that I used to try to fit my Jewish background into sort of the yogic way. What kind of meditation from the Jewish perspective could be fit into the yogic perspective, but I've fairly recently found that the Jewish meditation is in and of itself its own path. It's a very spiritual path.
You said to me the other day, and I want to see if other people have comments about this, that the Eastern concept of God is quite different than the Jewish concept of God, that Judaism sees God in different kinds of forms. Does that?
Not quite. No, I think like in India in particular, in the Hindu yogic perspective, they have lots of gods. They have millions of gods. Mm-hmm. I mean, there's one God and there's one consciousness, but there's lots of ways that God can manifest. Krishna or Sita or Ram or Vishnu, or Kali. There's lots of different ways that the Hindu gods manifest, but they also believe in one consciousness, that everything is connected. But Judaism is the same way, actually. And Judaism believes in definitely one God. I mean, it's the Judaic, Christian, Muslim tradition is one God. I mean, that's definitely. But in the Judaism, there's different aspects of God.
Yeah, I think I meant different aspects of God.
Yes, there's different aspects, different names of God.
Yes.
And so I've been studying a lot about that, and some of the prayers and meditation techniques are very quite similar to the yogic perspective. But they're different enough where I can keep them separate, and it's kind of fun. Like there's a concept in Jewish meditation. It's called the Sferot, which are the tree of life. You may have seen that, which you'd be interested in. It has 10 different spheres in it. And if you study that, it's the way the divine God manifests into human form, into the universe. The universe as one consciousness manifests itself in certain ways, certain patterns, right? We all know we live in patterns. So these Sferot are the way God manifests itself into the world. But the chakras are the same way. Yogic chakras are the exact same idea. That they're the way energies manifest from the one consciousness through the centers of our life, in our being, in our physical, spiritual, and energetic parts of our body. They're very similar concepts, but they're different. They're different ideas.
You've had an exceptional ability to integrate different threads of knowledge.
Yeah, I think that's one of my, if I were to say I had an ability, is that. I see it. There was a man who I studied with, because I used to say that all paths leads to the same. So if, the religions are all different, but at the end, they all merge. They all believe in one consciousness and one divine being, or whatever you believe in terms of the oneness of the universe. That's the spiritual side of religion. But I don't think that way so much anymore. I think that the one consciousness is really like a quilt. And there's little patches in that quilt. and they can be different. They all are part of the whole. They all have staged something different, but in a cool way that appeals to different people, the way they're born, or where they may choose to be a different religion or a philosophy. But it's like life is like a quilt, and that the quilt itself, the patches on the quilt are really what makes us so unique as human beings. So that's kind of the way I see it right now.
How do you feel about getting older?
I've been thinking about that a lot, though.
Yeah.
Yeah. I just turned 75, so I'm a little older than you guys. Not as old as Tom. But not far behind. And I've been thinking about that. So I've been blessed with longevity in the male side of my family. I had a grandfather lived to be 102. Another grandfather lived to be 98.
Ooh.
My dad lived to be 88, but he smoked cigarettes, so I don't know how long he could have lived. He had all the stigmata of smoking cigarettes.
Wow, that's a lot of longevity in
Yeah.
male grandfathers.
Yeah.
I don't know if I know anyone else who's had one grandfather who lived to 102 and one 98. I feel like there's somebody we know who has two. But go ahead.
So I don't think about dying. I haven't thought about dying very much because I have these sort of images of these grandparents, and my grandmother's lived a long time too. So unfortunately, my mother died early. It was sad. She smoked. Again, she had lung cancer and died at 63. So, and you said something interesting to me the other day when we were meeting about maybe the heartache that she felt, that she couldn't help herself from disengaging from me, because she did the same thing to her brothers, and it was a pattern that she had. And for my father, she did that same thing to my father. And maybe her pain caused her to, cigarette smoking will kill you, but maybe that also, I'm really glad we were reconciled at the end, because that was how important for her and me, but that takes its toll. Whatever you do, one of the advices I can give you is just don't hold on to grudges. Don't hold on to stuff you don't need to hold on to. Life is hard enough, right? Don't make stuff up that you don't need to have, There was no reason for my mother to do that, in my mind. It was her own pain that did that. And I think she suffered. She suffered more than me, probably. Because I had my father, I had my ex-wife's parents who were nice, I had this spiritual teacher, I had a community of, the Timberland Institute, I had a lot of people around me, and she isolated herself. And so it was sad. So that's one piece of advice I can leave, I want to just communicate to you is don't hold on to stuff. There's a lot of pain and suffering in the world. Don't add to it stuff you don't need to have. There's enough we need to deal with it in reality, right?
So that estrangement with her was kind of formative in some way?
I learned a lot from it. And I learned a lot about suffering. The other thing I'll share with you, because this is about personal stuff, I had a son who died. I had a son between my first and second sons who died of sudden infant death. He was completely healthy. And then one day I went up, he wasn't waking up at the normal time, and I got kind of nervous, and my other son was watching Sesame Street, and he died in the middle of the night. And talk about suffering, if any of you have lost a child, you know what it's like, whether it's young or old. He was 14 months old, which is really old for SIDS. So, it was a terrible time, but he taught me compassion. I remember going back to work 4 days later because I had zero money. I had to continue working. I was building a practice and was in Ann Arbor, and listening to people's, stuff. A lot of times it's not very significant, and I'm thinking, I had this kid who died, And what the grief is, it was so profound, and over time I let that grief teach me about pain. I think I became a better doctor. His gift to me was to really care about people and understand their suffering, whether their toenail was bothering them, or whether they had an anxiety attack, or whether they had heart disease or cancer. People suffer, and I think my suffering led me to be a better person. I think a better human being, and to not take stuff for granted. Who would have thought my kid would die? was this holistic doctor, right? You know, took care of my kids and took care of my family, and you know, was a healer, doctor, and yet he went. So I had no control over that.
This may be a mundane question after what you just said, but do you think it had an, I mean, it's almost an obvious answer, but maybe you can talk about it, help you to treasure the other three kids, you know, his older brother and your two younger children because of what you went through?
Yes, I think, I don't think I would have treasured him anymore if Nathaniel hadn't died.
I see.
I think I you know, I just love my kids, and I like people, and I love people, and I think the thing it taught me more was compassion, is to really feel deeply what people go through. I mean, I lived it, and I still feel it. I mean, feeling it is around me. It's been interesting, actually. He's a little angel. Nathaniel means it's a type of angel, you know, in the Jewish faith. Nathaniel is one of the angels. So it means gift of God, actually, Nathaniel.
Does anyone here have a comment or a question at this particular point? Anything anyone wants to say? Go
I'm
ahead.
just gonna say it's really beautiful how you turn that into being more compassionate. I thought you were gonna say it made you feel more burnt out because your suffering was so great and people are complaining about their everyday pain or complaints, but you felt more for them. I find that really interesting.
Well, thank you. I appreciate that. I think that I had no time to be angry. I had no time to feel like, why did this happen to me, kind of thing. Because I had a kid. I had a little older son who was 3.5 years old, and I had to make a living. There was very practical reasons for me to continue to move forward. And my wife at the time was grieving too. I had to help her, and she had to help me. So, you know, just it's practical parts of life. I mean, we have to live. I mean, we're on this planet to live and do the best job. I mean, maybe something comes up afterwards. I kind of believe there is, and I believe in the idea of karma. And but you know, till we pass into another realm, we don't know for sure. But what we know is we hurt. Although the Vedantists would say this is an illusion.
What we know is that, I didn't hear whether you said we hurt or we here. What did you say? All we know is that
we are here.
We are here.
We are here.
Yes.
We are here, and our job is to live and take care of ourselves and take care of other people, and to live as ethically as you can, and make mistakes and learn from them. And that's kind of my approach. You know, try to help each other. A lot of stuff in the world right now. It's always been. This is not new. Stuff that's going on right now is no different than it's been for the last 4 million years of human existence, or whatever, how long human beings have been on this planet. It's just a different manifestation, but we got to keep making it better.
You just touched on a question I was going to ask you, which is, what do you, and you just touched on it, but what do you believe happens when we die? Obviously you can't know. At 75, what do you believe at this point? I guess I go back and forth. And there's a part of me, part of me is a materialist, like, okay, we got a brain and the brain guys, and we go, and that's it. But there's a bigger part of me that says that there's a continuum. And whether you call it karma and you come back, the Jewish faith we call it transmigration of the soul in the spiritual traditions. I think Reformed and Conservative Judaism doesn't really deal a whole lot with that. They just say, well, God will take care of it. But in the mystical traditions and Kabbalistic thinking, Zohar, there's the whole idea of transmigration of soul. You move on to a different soul. Or your soul stays, but you move into a different body, which is kind of what in the Asian traditions they do. They believe that. So I guess I lean more towards that side, and I don't try to be a good person because I'm worried about my next lifetime, because there's enough to deal with right here.
karma manifests itself right here. I mean, you do something against your values, your conscience will bother you. And why do that? So be consistent with who you are. Do the best you can. I think that's really important. But in terms of death, we die every moment. And so if we die every moment and we're reborn every moment, why would that continue after our bodies have changed into something different? I've had enough, experiences in my meditation that I feel that makes me feel that there is a continuation. Yeah.
Brian O'Donnell, you're a spiritual teacher in the path work. What do you believe happens when you die? You're also, you're not quite 75, but you're 73. What do you believe happens?
Believing and knowing are different things.
Yes.
Well said.
And Dennis alluded to that. Yeah.
I believe that we go on, that we're a soul that's learning, go back to home. So we're here as a school to learn, and each lifetime is a class that we're taking, so we can become more whole. So I think there's a continuation also.
A continuation also.
Yes, the life goes on.
Ken Kazura, you want to tell us what you believe?
Oh, glad you asked. Well, I always, for every, I tend to always come back to frame everything under the saying and the concept that all is one. If all is one, if we believe that, and in physics we say energy is not created or destroyed, it's only transformed. And if we're of cosmic energy, which both physicists and spiritualists, maybe I shouldn't speak for physicists because I'm not a physicist, but we're part of a cosmic energy. That energy goes somewhere. Personally, I don't. I have a comfort level with the fact that I have no idea. I'm completely at peace that I have no idea.
You are.
And I'm not worried about it. Because I think our energy will move to different places and transform into different forms, and I don't care what form that is, and hopefully it's a positive, it's a positive energy that flows forward.
Well said.
Yeah, very nice.
I remember when after Nathaniel died, I remember reading. I was really interested in the Sufi movement, and I did some Sufi dancing, and I was interested in. There you go. And I was interested in. I met Pirbalat Khan back in the 70s, and then his father Hazrat Khan. I had read some stuff about. He talked about what happens after dying, and I read everything I could read about dying after Nathaniel passed, and I had known more about the Eastern, the yogic perspective, the Indian perspective. But I remember one thing Hazrat Inayat Khan, yeah. He said that from the Sufi perspective, or maybe it was his perspective, that as the soul leaves, it scatters. And it scatters into the cosmos, energy or spirit, whatever that is, and that it binds to other beings, other energies, so that when you're reborn, you're not reborn in as the same person, but you're merged into the greater cosmos of beingness. Kind of like the water in the ocean, right? So there's drops of water that make the ocean, and one drop will come in this wave and be picked up by another wave, and the waves have formed, and so it's like beings also form from various parts of the energy that has been released in death. and that the evolved souls, in this particular way of thinking, had the ability to, through meditation and through righteous action and all that, to maintain a consciousness when they die, so they don't scatter as much. So when they come back, they have more say in when they come back and how they come back. That's not too different than the idea of karma, and it's not too different at all than the idea of transmigration of the soul in the Jewish faith. So, Ken, you said it really well. You brought in physics, and Einstein says energy is not created or it's not created or destroyed. It just is. So consciousness is a form of energy, right? So it changes, and to be comfortable in that is a really good thing, because I think what will happen, and do the right thing as best you can in your life, and hopefully good things will happen. I have a friend. She's in our kirtan group. Her name is Shar Smith Fryer. She's a very old friend, and my oldest friend's wife. And she was raised Catholic, and then she converted to Judaism because Rick is Jewish. And then she decided that that wasn't enough. She became, she's got a Sufi name, and then she got into sort of other spiritual traditions. She said, I'm going to get as many spiritual paths in my life that I can to make sure that when I get out of this life, I'm going to go to the right place. She's like the funniest person. She has delivered 5,600 babies in the inner city of Cleveland. She is the Earth Mother. You got to meet her if you ever come to our kirtan group, which you can talk about. Everybody in my kirtan group is amazing, but you should guys talk to Shar sometime. She's so funny.
What do you love about your kirtan group?
Oh gosh, I love it. It's just my friend Jerry, who's lived in the ashram with me, took over my practice in Chicago, was an Orthodox Jew, and he's been trying to push me to explore this part of myself. He said, Denny, you are one of the wisest people I know, but you really understand spiritual stuff, but you're not connected to God. You're not talking to God. You're not feeling. You're not speaking with God. And I say, yes, I am. I do that through kirtan. When I sing the names of the divine, I am speaking to God. I am speaking. And I don't know if you guys are Hindu or not, but you guys probably would know about Krishna and Ram and right?
Yes.
Yeah. Okay. I'm sorry if I stereotype you, but my wife is Indian, so I can say it.
You're correct.
I know the culture pretty well. But so when I do kirtan, it's speaking the divine names, right? When we sing from our heart. So that is a way to speaking. But there's another way to speak to God, which is silently, not asking for anything, but just relating to the oneness of the divine. And I think that through prayer, I think Christians who pray a lot, and Muslims who pray a lot, and Jewish people who pray a lot, and Hindus who pray a lot, and Buddhists who pray a lot, and American Indians who don't have a particular religion who pray a lot, they're talking to God, and I want to do that more. So in my meditation, I start dialogue, which I never did before. It's been really interesting.
Did your Orthodox Jewish friend buy your point of view, or what was his response to that?
Jerry challenges me, and I challenge him, and I'm going to his son's wedding on Sunday, and we just love talking to each other.
You can agree to disagree.
Yeah.
As opposed to not even able to agree.
He said to me, you go talk to the rabbi in Ann Arbor, and the Chabad rabbi, and you say to him, I believe in consciousness. How does that fit into God? So you ask him that question. So I did. I went to Rabbi Goldstein and I said, Rabbi Goldstein, I believe in consciousness, but how does it relate to God? So he looked at me and goes, you can't ask the question. Because we can't ask the question of God. God is, it's unfathomable. So I challenged him again, but it was really cool actually. I'd never talked to him before. I'd seen him walking around with his hat and stuff, and his pay is, and I just it was really a wonderful conversation. And I told Jerry was proud. I'm proud of you, Denny, for doing that. So.
Will you tell us a little bit about your 3 grown children?
Oh, sure. Yeah. That's other than my 9 grandkids. I have 3 kids. Abraham is my first one. He's 46 and he is living in Chicago. He's just a wonderful person and just really good caretaker. He's pretty successful. He's a partner in an economics consulting company, and he's a righteous guy. He does the right thing. He loves his kids. He's funny. He's giving. I really like him. I mean, we're buddies. And my 70th birthday, 70th birthday, we did a video. My kids did a video of it, and he did this really funny thing that he wrote when he was little about his funny-looking dad who had a funny-looking beard, who asked too many questions. And he said, "But I really love the guy." And he was like in 3rd grade. He said, he may look funny, but he's strong. He's strong in spirit. He never yells at me, and you know what? He's my friend." And then he said it in the video. He says, "And he's still my friend." So we're buddies, you know. And he, you know, he's an athlete. I'm an athlete. I played sports, and I wanted to be a professional baseball player actually, but my eyes, which were gave up on me. And he was a great athlete. He was all-state everything. Anyway, so I lived a little vicariously through him. He played college sports. And then my middle son was my rascal. I bailed him out of trouble all the time. He was couldn't read till he was in 3rd grade. Graduated and did some stuff for a while and got a job in Cleveland. Went to graduate school, got a business degree, and now he's worked himself up as president of the 3rd largest private healthcare company in the country. He's done very well. Unfortunately, he's separated from his wife. Not separated romantically, but because he's got this job in Nashville as the president of his company. He's checking it out, so I'll move up if it works out. And so he's great. He's got 4 kids. He's a good dad.
He didn't get that from you, though.
No, I was pretty quiet.
Yeah.
And then my daughter and I are like great friends. I mean, she probably challenges me more than my boys do. When I get redundant, because I can get redundant, or when I, you know, my clothes are funny, she'll say something to me. And we laugh a lot. She calls me 4 or 5 times a week. She's in Spain, living in Spain right now, and she'll call me in the middle of the day. And you know, she has 2 little kids, 4 and 6, and so we just have a fun time. So I have a great relationship with my kids.
You're a lucky guy.
I am.
3 healthy kids who are all doing well.
Yeah. And a child who died.
And a child
Who died. So it's like, you know, our blessings. We have our blessings, and we also have our sadnesses too. And none of us get through this life. I didn't get to 75 by, you know, not having stuff that happened. You know, that was sad. But it's all good because we're here to learn, and I believe that real strongly.
Seems like those early years with Swami Rama really were profoundly important in terms of shifting the worldview.
I think they were, you know, and he helped me in my relationship with my mother, you know, because he was very loving and very accepting. And would ask me about her and encourage me to talk to her. And, you know, it was it was an important time. Yeah, I really solidified who I was. This alternative path that I'm on, I think, was started by those 4.5 years. I don't know where I would be if I hadn't gone there. I probably would have been a psychiatrist.
What's been hardest, Dennis?
Probably my divorce.
Uh-huh.
Yeah. My death of my son, but my divorce was really hard for me. But I'm happy now again, so because he's hanging there. I expect my partner to show up any minute now. She had another engagement, maybe she'll come, but I think she'll come.
You told me, I mean, I know this anyhow, that, you know, that Ruma is really a kind of a world-renowned biochemist.
I'm glad you're saying when she's not here. She would not like me to. She's very humble.
And but she's 12 or 13 years younger than you,
Yeah.
at a very different stage in her career. What's that like for you as a, you know, is that fun? Is it hard? I mean, what's that like to be kind of, you're sort of ready to sort of shift, and she's kind of peaking.
Yeah, well, that's true. She's kind of remarkable in terms of her work, and she is world renowned. And she is very busy. Busy. Yeah, and she works hard, takes care of her lab people, and is on committees all over the world and travels all over. And I'm proud of her, and yet we are in a different phase of our lives.
Yeah.
Yeah. And so one of the reasons, there are many reasons why I have made the decision to retire from my family practice, which is another part of our conversation, is because I needed to, because I feel like I wanted to. And at the same time, I realized if I'm not busy enough, and she's very, very busy, it would be good for a relationship. I mean, that's, a lot of times when people are the same age and they retire together and they can do things, but you know, we're really at different phases. I get to travel with her a lot, which is great. But I don't want her, there's 3 reasons why I'm retired from my family practice, I'm moving into a consultant role. I'm going to be working 1 day a week in my office, and I'm going to do holistic medicine, no medications, no referrals for specialists, no running tests like x-rays and radiology and things like that, and blood tests. I'm just going to have people come see me for homeopathy, meditation-related things, and nutrition. And that's what I'm going to do. And so I made that choice because I love seeing patients, I love being with people. So I'm going to stay doing that. And I think that'll be fulfilling. I'm also going to stay with my public health jobs, which don't take that much energy because it's mostly remote. Because they want to keep me, at the same time they recognize, they push, if I had to go every week, it would be hard to travel that much because they're all far away. So I stay in that, and the other part of this is because of, you know, I want to be busy, and Ruma's very busy, and I really want to, I need to be busy.
You don't want to be too unbusy.
I don't be too unbusy.
You feel like it's out of balance with her.
That's right.
Yeah.
So that's another reason. And then intellectually, I think it's really important for me to stay in the game. You know, spiritually, intellectually, that I feel I like helping people, and gives me a lot of satisfaction. And so people hopefully will come see me in a different capacity.
A question that somebody asked me to ask you, so I want to, by saying that, give this person credit for it. She said to ask you, when or where are you your best self in your life?
A father, a life partner, grandparent, and a doctor. They're all the same. That's. I don't see them different. It's a way of giving. It's a way of just serving as a parent, serving as a partner, serving as a physician. I think that's where I'm the best at. I'm not so good with building stuff. Not the best. I had a hard time putting this little doodad together. I'm really bad. I think I have a certain amount of, I don't know, it's not ADD, but it's I reverse things a little bit, you know, so when I look at, like, Tom knows, because he's my art teacher, and I can't draw worth anything, but I have good color sense, and I
Produce some really nice pieces of art.
Well, thank you. Coming from this man here is the second best artist in the world.
Okay.
He is.
Who's the best?
Van Gogh.
Oh, my goodness.
As they say in India, though, in Europe, Van Gogh.
Yeah.
Do you want to tell us a little bit about teaching Dennis art?
Picasso would roll over in his grave. I don't know about that. Well, he has been coming in once a week, and we paint together. And I don't regard myself as an art teacher. It's something that I do. It's something I've kind of learned on my own. I was an art major in college for a couple of years, but kind of dropped that and went into psychology. And so I don't regard myself as an art teacher who's got an MFA and has taught, but he comes in and he enjoys watching me paint, and he paints, and he's produced some nice pieces. He did some beautiful abstracts for his daughter, and
How many years has he been doing this with you?
just maybe a year and a half.
4 years. 3 years.
Is it three? Oh my God.
It's
See,
been-
that's something that happens when you get older. It's like the days get longer, but the years get shorter somehow.
Yes, yes.
And all of a sudden, I can't estimate the number of years. Oh, yes, I met him 20 years ago, and I thought I met him 3 years ago. Yes, it hasn't been that long. So, and we've got to start doing it. We've kind of fallen away from. I got busier in my psychology practice here recently, and there seems to be a demand for that. I don't know what's going on in the world. People want to see psychologists, you know, and I keep adding another person onto my schedule, and I try to pull back the way you do, but
It's hard.
It's tough. But I've got a little different subject. I've got a wonderful daughter we have a brain injury facility, and she took that over, thank God. And she's doing a wonderful job.
But what a
So,
range
yeah.
of things. I mean, you're teaching him, doing art with him, but breathing and meditation and yoga and Kabbalistic Judaism and you haven't talked about Tai Chi at all. Many years ago, you did an interview with Richard Miller in town because you were busy. You were always practicing Tai Chi. What have you loved about Tai Chi, which you haven't talked about here at all tonight?
I think that Tai Chi was my first love, actually.
I see.
Yeah, it was before I met my first wife. And, I was in San Francisco, and I was just cruising around, having fun in San Francisco, being a hippie, Dr. Hippie guy, and I saw some people in the park doing this stuff. And I go, oh my God, it's so beautiful. I couldn't believe it. I'd never seen it before. I fell in love. So I came back to Ann Arbor, and I started working with Bob Thorson and Bob, and then Richard Miller a little bit later on, and have maintained. Jay's a martial artist. He's one of the original martial art guys. Don't mess with Jay. He'll kick your butt. But he's beautiful to watch. So I learned. I had to learn it. So I came back to Ann Arbor, and I learned it about 1973. I started doing Tai Chi with a group, and Phil Ho was their teacher. Remember Phil? He was a great guy, yeah. And then Bob, and then Richard later on were my teachers. There's a lot of ways to meditate, right? Let's define meditation first. Okay, that's really important. Meditation, in the way I define it, is sustained focus on a single object. Okay? There's a continuum in the yoga tradition. There's 8 limbs. They're called the Raja Yoga, and the 6th limb is concentration. The 7th limb is meditation. The 8th limb is samadhi or absorption. So concentration means focus on an object. So say you want to focus on the sound of Om. Om. There's a space. Om. A space. Om. Space. That's concentrating. Concentrating. It can be anything. It can be a color. Or your breath. Meditation is sustained focus on a single object. So instead of Om break, it's Om. Your mind stays on the Om. And then the eighth part of this is called samadhi, which is absorption. You become Om, become the process of Om, the vibration of Om. So so meditation basically is that process of bringing your mind into single focus. What did you want to ask me then about that?
I just asked you, what did you love about Tai Chi? And you
Yes,
said it was
okay,
your
so,
first love.
right, I got to start meditating. Tai Chi is movement meditation. It's sustained focus of your body, mind, and breath. So this is called the horse stance, like this. And then this is called cloud hands. So you put your mind and your breath in this particular movement, right? So this is a meditation. So there's a form, there's a 24 form and a 72 form, which I do. And so your mind, your breath, you're inhaling and exhaling, and your consciousness is all single focus. I mentioned Sufi dancing, so when the Sufi dancing, there's this movement like that. Their mind is focused on a single point, and that's another movement meditation. When Jewish people daven, the daven like that, it's a movement meditation. Their mind is focused on their movement, the body movement. So there's sitting meditation, there's movement meditation. You can walk in a labyrinth. There's a whole process of walking meditation. If your mind becomes focused on a single object, then that is a form of meditation. Okay, so you can meditate on a color, you can meditate on a sense, you can meditate on a vibration. In my tradition, we tend to use mantra and visual frequency. I mean, we tend to meditate on the chakras. And in Tai Chi, I studied with a really interesting woman. Her name is Li Ping Ju. And is it Li Ping?
No,
Oh,
it's
okay.
just, it was
Such
just
an
Leaping
interesting
Jew.
Leaping Jew?
Oh, Li Ping Ju, yeah. We actually did a seminar together in Tassajara.
Spell that, please.
And it's ZHU. So
No,
we
it's not.
so we did. No, she's Chinese. So we did a seminar together.
Lipingchu. That's funny. But I heard Leaping Jew also.
There's Wandering Jew.
Leaping Jew.
It's really funny.
Neurotic Jew.
But in light of that, we actually did a seminar together at Tassajara, which is
A lot of them come from Jew York.
we did a seminar together in Tassajara, which is a Zen Buddhist monastery teaching program, and she was teaching sort of microcosmic orbit Chinese meditation and Tai Chi with that, and I was teaching sort of the yogic approach to it, and we call it the seminar of the two Jews, because that's how it's Jew, ZHU in Chinese is Jew. so we had fun with that. You gotta watch her sometime on YouTube. She's absolutely gorgeous.
Jay?
I just want to say, I have to leave now, but a couple things. I love Dennis. Dennis, a lot of people love you. And everything, I mean, it's been amazing. And I just want you to know, I started my practice as a DO 36 years ago here. I had done this, alternative stuff for the last 46 years. When I came here, one of the first people that helped me was Dennis, who's kind of like a mentor. And he's always been there for me, literally since the day I met him. And I've been able to call him for personal family things, for my patients. When COVID came, literally Dennis was kind of my lifeline, because he really carries what you all heard tonight, that he's this amazing person who's extremely knowledgeable and skilled and wise in what you would call Western medicine, yet at the same time embraces all these things. And so when you ask him his true opinion on, hey, I have this person who doesn't want to get their kids vaccinated until blah, 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 and vaccinations have been a big thing in the world and in this town. And when COVID came, and even he was in Italy, And I have now like all these people that come to me and go, Dr. J, do I take the new COVID vaccine, blah, 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 blah? And I always go, give me a day, maybe 2, because I'm gonna ask my guru, my person who I respect more than any single person, literally that I know, and I'm sure Dennis has his people, but throughout this whole COVID thing, and he was saying how complex, I would call him and I would ask him kind of Bill Zarinsky questions. I would. I'd say, Dennis, do you have a minute? He's always returned my call, my text, like very, despite being busy. And I'd say, Dennis, this is the situation. What do you think the right thing? And what's great is he's never given some kind of patent answer, which is the problem with Western medicine right now. In fact, I remember, I've had the good fortune to have this practice where I've never done insurance for 36 years. So whereas there's the good and the bad of it, I get to just be honest and be me and not be like, the insurance company tells me I should start you on this med. And then only if that one doesn't work, then I'm like, the Blue Cross used to literally send these cheat sheets to all the doctors saying, if someone has depression, do this. If they have joint pain, do this. And this is how, this still exists, that this is how you do like standard of care, be a good, loyal, like doctor who's doing the thing, which we'll talk about this during my thing, but Dennis just so unbelievably is so balanced in his answers. Like you've heard him say about COVID, all vaccines, interventions, mixing homeopathy with Enbrel and DMARD drugs. Like he's just my hero in that sense, and I feel blessed that we've had this friendship, and I just want to say I'm so glad I came tonight.
Thank you, Jay.
You're just such a wonderful human being. And
Right back at you
I think
too, by the
everyone
way.
could just feel like who he is.
Thank you for sharing that.
And
I
thanks
didn't
for-
know
thanks-
he had been this
Yeah.
primary mentor to you, going all the way back to the early years. I
Yeah,
didn't
well,
know
and
that.
you know how he said the thing about cancer, like when I came to, like he knew that I had in Ann Arbor been a holistic energy balancer,
Yes.
because I did that and did it well. And then I said, hey, probably because my Jewish grandfather who was like, what are you doing? Because I was a philosophy major. And he's like, what are you doing? I go, well, I'm doing this. He goes, he goes, philosophy, you can do that when you eat. He goes, be a doctor, be a lawyer, you're a smart boy. So then on his deathbed, I saw him, and he was dying of metastatic prostate cancer. One incredible guy, and that's a story I hope you'll ask me about.
I will.
And he, I said, Zadie, I want you to know I got into medical school. And he goes, hi. Thank God. It was one where he's like, now I can die. And it was like, thank goodness, And I went to med school when I was 31, right? So, but yeah, so when I came here, I said to Dennis, can you give me just a couple pearls? Like, what can you advise me? Because I'm going to open this medical practice here in Ann Arbor. And he goes, hey, Jay, listen, I know you're going to do whatever. And this is paraphrasing, but he goes, the 2 things I'd say, be really careful with cancer and be really careful with children. Because those are the 2 things that if you don't really do the right thing, you can get burned. He goes, otherwise, that's my advice. And like what he just said about finding that really important balance with each family when it comes to those things. But again,
Thanks, Jay.
I hope you live to be 102 or more. No, because it's you have so many things that you're offering.
Well, thank you, and I appreciate that, and I right back at you in terms of it.
And you
inter-
come to things for a reason. And the other thing is like recently, and I've had some personal health things lately. Unfortunately, I'm hoping it went well. But one big thing that came to me was I have to draw or paint. And all my life, I always felt like that was one thing. I was in a rock band. I played music. I can sing. I did musical theater for 10 years for Burns player. But I always wished and then you're here.
Yeah.
No, I mean, it's just like, okay, so,
Join us,
so
yeah.
I will be getting from Dennis or whatever your contact, and that's
That'd be
really,
fun, yeah.
that would be really cool.
Getting to know Jay would be fun.
I
Getting to
would
know
just
Tom would be fun.
love to just, you know, come and hang out like a fly on the wall with you guys and then maybe do that. So.
Ruth, do you remember Jay in Fiddler on the Roof? Burns Park Players?
Of course they do.
Yes, yeah, me too.
Oh, were you
We're
telling me?
wonderful.
I was supposed to be Teddy. I was laser, but it's okay. That's when you say, "What's your greatest regret?" In the musical theater, was not getting Teddy, but
Oh
no.
my God, you're like you're perfect, have you? I mean, it's like.
Well, here's the thing. So yeah, so everyone thought that, and then what happened was, it was great. After we did our first show, this guy comes up to me, and he's an older gentleman, and he goes, "You." This was at Tappan, you know, after we did Fiddler. It was a great night. He goes, "You, come here," and he goes, "This is amazing." He goes, "I worked at the Fisher Theater. I did this and this for 10 or 15 years, professional theater." And he goes, "I've never seen a local group like this." He goes, "Your costumes, your orchestra pit, your everything, you know, like this is the most unbelievable professional." He goes, "There was only one thing wrong with this." And I go, "What?" He goes, "You. You should have been Tevye. What's wrong?" I go talk to her. And so I pointed at the producer. And everybody, that was so funny. So then I went, all right, somebody's funny. But anyways, can I end with one joke that I thought of when Dennis was talking about his mother, but in India, and because I've given talks, laughter is the best medicine, and I did it for Ari and Zingerman, and I'm about to do it again. But it's the famous joke, and I'm sure maybe you even told it to me, where this woman arrives at this ashram in India, and the people go, "Can I help you?" And she goes, I need to speak to the Swami now." And they go, "No one can speak to the Swami." It's almost like the Wizard of Oz. No one can, you know. And the Swami is in deep meditation. She goes, "I'll wait." They go, "But it may be 3 or 4 hours." She goes, "I'll wait." And 3 or 4 hours go by. She goes, "Well, can I speak to the Swami?" They go, "All right, we'll tell the Swami that you're here, and we can't guarantee it." And then this goes on, and I can tell it really long. Finally, the Swami comes out, and she goes, "Sheldon, come home now." So, anyways, with that,
Thank you. That's a great.
Thank you for coming, Jay.
yeah, what a great decision I made coming here tonight. Thank you.
Thank you, Jay.
Yeah.
So we have to begin to wind up in the next 10 minutes because they want us out of here starting at 9:10. I also want to leave. If anyone wants to buy a book or something, they could go downstairs and buy it. Does anyone want to say anything or ask questions or anything like that for just a few minutes? Go
Quick
ahead,
one.
Susan.
Is Dr. Valentine still living?
Whoa, that's amazing. Did you ask that question?
Because I'm fortunate enough to see him in Buffalo at the Himalayan Institute.
Oh yeah, we had an organization. Yeah.
Yeah.
I believe he is. He is now a Swami himself, and I believe he has a students, and they have an ashram, and I believe it's someplace in South Carolina or North Carolina. Yeah, I'm not in touch with him anymore, but I heard from the grapevine. He once sent me a patient, which was nice. I mean, but I haven't really been in contact for 30 years, 25 years. But through the grapevine, I've heard. Yeah.
Well, I hope you live to 102 also, and I'll only get 106 then.
That's true.
Go ahead.
I just wanted to ask kind of a very general question for you, like what's next? Especially since you're only 75 and you could live for several more decades. You know, what might you do next that you haven't yet done?
Good
You've surely
question.
done a lot.
I think I want to. Hi, Rilla. What's next?
It can be more than one thing, just what are some things that you might want to do you haven't yet done?
I want to chill a little bit. You know, I've had a lot of responsibility in my life, and I feel that I want to continue to have responsibility, but in a different way, different pace. I want to have freedom that I haven't felt before. I've always felt free spiritually and in my beingness, but I think that I want to have more time to explore other things. Like maybe Jay and Tom and I will paint more.
Yeah.
Maybe I may take up the guitar. Maybe because I don't know anything about string instruments. I know about percussion, and I know about piano, and I know about harmoniums and things like that. I play the harmonica. I want to do something different like that. I want to open myself up to different ideas. I want to be able to explore, hang out with my grandkids more. I want to travel with Ruma more. Not feel like, okay, gosh, I got patients and I got to be worried about, getting back to making my phone's on, and I make sure that I'm traveling and I have. See you, Jay. Thanks, Jay. I want to be able to have that freedom and still be vital. Still have the importance of my medical practice and be public health physician and stay healthy. So just yesterday, I went over to Lifetime Fitness and I said, how much does it cost to join? Ruma was telling me the other day, you got to work on your balance a little bit. I'm an athlete, and she just noticed I'm not quite as. So I'm working on my balance. I'm doing my Tai Chi a little bit more. I'm working standing on one leg a little bit more. I'm weightlifting, doing weight kind of stuff, and so I want to stay healthy because as you get to be older, health is an issue, as we all know. So,
It's interesting, you're 75 now, so I like to think of our lives as going in like quarters. So now he's in the fourth quarter. And that's actually the most critical quarter, and it's a lot better than like overtime, because that's sudden death. So, after 75, you're in the fourth quarter, live to be 100 or 102.
102, yeah.
Yeah.
There is a tradition in India where they divide things. There's 4 phases of it, of life. And the first one is learning, growing. Second one is householding, having family. Third one is sort of the family starting to leave and you become more of a grandparent. And the fourth is spiritual growth, and you're devoted to that. So I am definitely, like I told you about my Jewish path, that's becoming more important to me. I want to integrate my spiritual paths, but the Jewish faith, and still be, ecumenical and explore the things like Zen Buddhism. I've studied that. I've studied a little bit of Sufism. I've studied a little bit of a lot of yoga, philosophy. So I want to integrate that and become, spirituality becoming the centerpiece where I'm not having to. Taking care of patients is spiritual. And taking care of kids and grandkids, as I said in the beginning when Bill asked that question, it's a very spiritual thing for me. But there's time for myself too a little bit more. I've been really taking care of other people. I've always taken care of myself. I eat well, I exercise, and I meditate and do those things, but there's a deepening of that I want to do. So thank you for asking that question. I think that's important for me right now.
Yeah, I appreciate that question too, and I think it's a good sort of ending note almost. I really do. We are going to need to sort of begin to end, and I want to ask one question that's related to what you were just talking about. And before I do that, I kind of also want to say that I really appreciate you being the first person for me to do this sort of public Q&A with. Over many decades, I interviewed a lot of people for the Crazy Wisdom Journal one-on-one, and then we'd publish it. It's the first time I've ever, in a sense, channeled my inner David Susskind, and who was a New York interviewer, Ruma, that if you were my age growing up in New York, you watched him on Channel 5 and he would interview everybody, political, business, authors, and so on. He was years before Dick Cavett and so on, and all those people. So thank you. I'm so grateful to you for doing this with me tonight. And I want to just ask you, where, aside from going along with Ruma's professional trips, where would you like to travel with Ruma in the world that you haven't been to?
Interesting question.
What did you say?
SpaceX.
SpaceX.
Turkey is a place that we talked about going to Turkey. It's a kind of a crossroads of many traditions and timeless kind of place, Asia and Europe and Middle East, and it's sort of Hassan, you have Turkish ancestry, don't you?
From Turkey, yes.
Yeah, so Turkey would be a place that I'd like to go. What's that?
The town is Mir.
Mir? Izmir. Yeah, so Turkey would be a place. I've talked about going to Southeast Asia. I actually had an opportunity to go to Vietnam with my friend Rick Goodman, who's moving back to Ann Arbor. A big shot in the CDC, and a wonderful friend, funny guy. And we almost went, thought about it. But we tend to go to India a lot. So there's always places in India that I want to go back to or see.
You were talking about Sufi. We saw in Istanbul amazing Sufi dancing. You know, just really the high spiritual Sufi dancing.
Whirling?
Yes.
First time I ever saw Sufi dancing was at the University of Chicago when I was living at the Himalayan Institute and went down to the University of Chicago, and they had Sufi dancers. I was blown away. Just beautiful. They had these skirts, and there was like beautiful movement. And I've done a little bit, but I've done something called Bagua, which is another martial art that Jay probably knows about too, where we do a lot of turning. And we could turn for 45 minutes, and you basically look at, you learn to fight over off a circle. And it has some semblance to Sufi dancing. So you have to really be careful because you get very dizzy. You have to learn to, you ever see these skaters that go round and round and round and fast?
Yes.
They focus on one point, otherwise they'll fall over. And that's what you do when I do this circle turning, when I was doing it. And I know that the Sufis do that. They look at their finger and they continue to watch that.
And because we have to stop because the staff is going to want to go home on time, and they've told me that. Is there anything that you want to end with? Any final?
I would like to end with those of you who are interested in kirtan. You guys have hosted us. It's a wonderful way of chanting. It's call and response. We call, people respond. There's some beautiful instruments. The tabla, John Churchill is an amazing tabla player. He's a Grammy Award winner as part of our group. I'm so honored to have him in our group. As mentioned, Shar and Rick, who are great healers, and are part of our group, bass guitar. We have a violinist. It's a wonderful way of communicating. It's creating what we call in the Buddhist tradition is satsang, where we create a community of like-minded people. So we call, we sing, and then the audience responds in the same way. So come join us. I have some flyers out there on kirtan. Do you know kirtan?
I do, yes.
Yeah, there you go. So come. It's October 18th at Prana Yoga Studio. I have some flyers here. Just grab one and come join us. It's a wonderful time, and we get anywhere from 40 to 80 people show up and sing together. It's very powerful when you sing with a group of people. Ken, we've done kirtan together. Yeah, and Ken's a great musician, by the way. You got to listen to this guy. So that's coming up. I have another flyer sort of explaining my new practice. Some of the things I'll be doing, the 4 major things that I'll be doing: not being a family doctor, not doing medications, not doing, ordering blood tests or x-rays or referrals, but just people come from homeopathy. We talked about homeopathy a little bit today, nutrition and the meditation-related arts, breathing exercises, which comes full circle. I'll be teaching a lot of that. And not having the responsibility of taking care of people's everyday stuff, but just being a consultant. It's going to be fun. Already I'm feeling pretty positive about it. It was sad. I've had a lot of tears. A lot of patients have cried and said, you've got your
I
doctor.
haven't cried yet. I haven't called that other doctor yet.
I've been nudging him for like months now.
I know.
And I look forward to painting again. Laura, thanks for taking care of your dad. I really appreciate that. We got to keep him around healthy. And Bill, I got to say, this has been so much fun. And I opened up a lot about some painful things with you guys. And Bill asked the great questions. If he hadn't been a very successful businessman, owner of a store, he would have been David Sutzkind. Because he's a really smart guy. And Ruth, thanks for taking care of him too. I appreciate all the new people that I just met today, and thanks for coming to Salon. That's really fun that you came and got to know me a little bit and get to know you. And so all those of you who haven't met before, thank you for coming. And thank you, Bill, for doing this.
Yeah,
I look forward to
thank
coming.
you.
Thank you.
I hope we'll do some more. Susan, you might want to speak to both Dennis and Ken, because Susan runs the Dances of Universal Peace, but doesn't know that many people in town. She's looking for someone to play music at the Dances for Universal
I'm
Peace.
sure, thank you.
So, yeah, thank you.